Well, hello everybody, and welcome to another podcast interview here on Purple Chorus. Now, I'm delighted to say that today's guest is somebody who I've been trying to organize an interview with more or less since the word go, really. And since my serious interest in the interrelationships between music and epilepsy began, because today's guest is one of the very few people whose names you will find if you actually Google or other browser search for direct interrelationships between music and epilepsy. She's a consultant neurologist based in Leeds in the UK and also an honorary clinical associate professor. I have to say I had to practice saying that a few times. So today, a very warm welcome to Dr. Melissa Maguire.
Thank you, Guy, and thanks for having me.
Thank you. So, as I mentioned, you were one of the very few, aside from Dr. Sally Baxendale, who's based in London, who have actually looked seriously at this interrelationship between music and epilepsy. So, my first question has to be the obvious one as to why.
Yeah, so it's going back a long while now. So it was actually a patient that I saw in the clinic that got my interest in music and epilepsy, and that was because she was describing temporal lobe seizures if she listened to choral music, and I'd never heard of that happening with anybody else before.
Mm.
And she actually had a seizure that was provoked during her EEG investigation with a particular piece of music, which I thought was fascinating.
Mm-hmm.
So I then looked into the literature and ascertained that this was a case of musicogenic epilepsy.
Mm-hmm.
So a very, very rare reflex form of epilepsy. So probably 1 in 10 million, something like that. It's very, very rare, not common at all. And then, as I say, that got me interested in looking at music in general, to explore musicogenic epilepsy a bit more, but also to look at whether, is music useful in epilepsy. It was very unfortunate for this particular lady because she was part of a choir, which obviously she ended up having to stop, and she became quite isolated actually, because she was worried constantly about walking into somewhere and listening, being exposed to music and then having seizure. So I felt very sorry for her, and particularly because she was highly musical herself, which actually is quite a common finding. So yes, in answer to your question, that's how I became interested.
Very good. And out of curiosity, are you a musician yourself?
Yes. So I played the piano. I did all my grades, and before I had thought actually about doing the teaching diploma before I went to medical school, but it never happened. Which is, I suppose it is a little bit of a regret. I do have a piano that I probably don't play enough and don't practice enough, but I certainly enjoy it. It's a way to relax.
Very much.
Yeah, and I just need to encourage myself to practice a bit more.
Oh, I think to be fair, we've all been there. Myself included. I mean, I play pretty much, most days of the week, but there has been times over the years where I've had to physically drag myself into the room and sort of play or write practice. But it's really rare to actually find a neurologist who has seriously looked at that interrelationship before.
Mm.
Um, Certainly, when most people think of music in epilepsy, the two things that spring to their mind are music therapy and the Mozart effect.
Hmm.
But obviously, as you will be able to enlighten us on, it actually goes an awful lot further and an awful lot deeper than that. Uh,
Yeah. So it's still a little unclear why Mozart was picked as the initial sort of musical therapy. I think it kind of goes back to the use of it in cognitive research. Again, the question as to why that was picked in cognitive research is a little unclear as well. But
yeah.
hey, look, it's a nice piece.
Hmm.
Um, and despite a lot of, I mean, obviously we'll go on to what's happening more recently.
Hmm.
People are still actually focusing on this same piano sonata, this
Yeah.
duet piano
448.
sonata.
Yeah. Yeah.
Yes, we have it. It is more complicated than that, but I
Yeah.
think the focus still remains very much on Mozart, and we so in terms of exactly why that was impactful in some of the studies that have looked into it at the moment, it still remains a bit of a mystery. There's several theories why that might work, but we're not really certain exactly why
Mm.
it might work.
Yeah. And
There
obviously,
have been other Mozart sonatas that have been looked at that seem to have a similar impact,
right.
and then other composers, Bach, uh,
Mhm.
Wagner, etc. They don't seem to have much of an impact. Um,
Mhm.
why that is, I don't know. I think that obviously there's a repetition in Mozart
Mhm.
music.
Yeah.
Some people think that might resonate,
Mhm.
with the sort of with the cortical columnar structure of the cortex, and others think it might be to do with dopamine reward
Yeah.
networks,
I've
dopamine
heard,
function
I
in the
have heard you
brain.
mention certainly the
Yeah,
dopamine reward element before. Yeah.
yeah. But as I say, the exact way in which it works is unclear. I mean, obviously, with any form of music, the entire brain normally is activated.
Hmm.
So whether if you play music, whether particularly Mozart, do you activate other areas of the brain which might have a direct inhibitory effect on
Hmm.
the motor cortex, for example? So,
Hmm.
but these are all theories. It's we don't really know
I
why,
was
particularly Mozart.
I was going to say because you said in 2012 in epilepsy that there were more questions than answers
Oh,
essentially.
yeah, yeah,
Um, and
yeah.
uh,
That's true.
and then when
That
you
was then.
reviewed it in 2022, um, what fast forward 10 years, has there really been much development in knowledge as to what music does to the brain and how epilepsy fits in therein?
I think, in short, I think it's still very unclear, actually. I mean, obviously, there are newer technologies coming through that are trying to explore what parameters of music might be relevant by looking at how they activate the brain areas. Um, so there's currently a system called System X,
Yes.
which is looking at EEG data in the
Mhm.
sort of relaxed state overnight,
Yeah.
um, and then trying to sonify
Mhm.
an audification of the EEG.
Yeah.
and then try and to create a, I suppose, a sound, and
Hmm.
then co-match that with a series of music.
Hmm.
So, I mean, clearly a very complicated system. I
Yeah.
think how they've devised that is actually a little bit unclear.
Yeah.
But it looks at a variety of different things. It looks at how it makes people feel, you know,
Mhm.
parasympathetic activity.
Yeah.
So it's measuring different parameters, and I
Mhm.
mean, obviously, the results of that are yet to be fully published.
Mhm.
And so that will be interesting to see. Obviously they're developing music as a sort of biofeedback,
Mhm.
um, bespoke, personalized musical
Mhm.
um, therapy.
Yeah.
So that would be interesting to keep watch of. But in terms of how does music affect how does it affect epilepsy? Because there's many studies that have shown it can reduce, interictal spikes,
Mhm.
um, and it can reduce seizure activity in 30% of patients. But how exactly it does that,
Mhm. It's
it
a
may
bit
be, it
like the
may,
magic.
maybe a variety of different mechanisms here.
Yeah, it's a bit like the magic trick. You know it
Yeah, it may
happens,
not
but
be
you
one
can't
thing.
explain how. Yeah.
Yeah. I mean,
Um,
is it that certain forms of music are relaxing? It slows down your brain waves. It manages to entrain the brain to a non-epileptic state.
yeah.
Um, you know, or is there something about the music itself which is remote from how it makes you feel? So, is there a direct effect?
Is it to do
Um,
with resonance?
Resonance, yeah.
Yeah.
So not not the emotive element, but more actually the physiological parameters of the music. These
Yeah.
are all questions that you're quite right. In 10 years, it's still a little bit of a mystery.
But it is still a fascinating mystery. You mentioned X Systems. When I was in Lisbon in September,
Yeah,
I did actually meet the X Systems team,
yeah,
or at least two of them. Michael Trimble,
yes,
who I've already interviewed on here. In fact, he was my first guest on here.
yeah, yes,
Um, and he is part of X Systems. And out there was Dr. Nigel Osborne
yeah,
and their colleague, who's a fellow called James. And they told me that, although quite rightly, as you mentioned, the official findings haven't yet been published, but the feedback seems to be that it has had a positive outcome,
yeah,
not only on epilepsy patients, but they are now exploring using that for trauma patients as
yes,
well,
yeah,
specifically frontline trauma patients who might have trauma-related epilepsy,
yes,
and looking at intertwining it more with the whole central nervous system as a means of non-invasive therapeutic treatment therein. So that's an interesting one.
yeah. I mean, you said non-invasive. I think this is the key, isn't it? There's many neuromodulatory um, technologies that we're already using, but they are invasive. Vagus
Mhm.
nerve stimulators.
Yeah.
Even the easy device is, it's a subcutaneous electrode. It requires a small operation,
Hmm.
whereas music is non-invasive. So
Yeah.
it is an area that merits more research.
Hmm.
I think it's just I think there's a kind of perceptional bias that it's not real, the actual effect. I don't know, because it's not perceived as being a serious contender.
I think it's
I
possibly
feel
because
that. I
it's
feel that.
yeah. I think it's possibly because it's possibly one of the reasons is because of the level of subjectivity.
Yes.
You know, it's not something you can concretely say, if you play this track of music, you will have this effect. Because
Yes.
obviously you could say play that same track of music to 100 people and have 100 different reactions. So,
Exactly.
so I think,
Exactly.
yeah, a
Well,
bit like
if you look
food
if you
or
look
art or whatever, you know.
so I think that's where, I think if music is going to be developed as a real contender for non-invasive stimulation, it is going to need to have some bespoke element to it. And I think, going back to Mike Trimble
Mhm.
and Nigel Osborne's work, I think that it'll be interesting to see the final results of that.
Mhm. Yeah,
To be honest,
well,
so
uh, it was quite fun for me because in the X Systems booth they actually had the EEG cap, um, and they had the machine there which instantly translated your electric brain
mm, mm,
activity into
mm.
sound.
Yeah,
Uh,
it's
uh,
incredible.
yeah, so they did actually have a little poster up saying, "Here, you'll listen to your brain," you know.
Rain, yeah, yeah,
Uh,
yeah,
and as a composer, I thought that was really quite interesting, you know,
yeah.
because one of the things that I did early on in my interrelationship of music and to the brain was I actually took my own EEG reading and interpreted that as a graphic score uh, for both for a contemporary piece and a more orchestral instrumental. So using the direction of the lines to indicate the direction of pitch. Uh, so that was quite interesting. Obviously, on a rather low level compared to how things are going now, but it was still an interesting process to do that. But when I was wearing the EEG cap and hearing my brain activity, and one of the things I thought of being of a curious mind, I thought, well, if I change my pattern of thought, will that in turn change the sound pattern? You know,
Mm,
uh, which would be quite interesting to have a neurologist look at. You know,
hmm.
like if it was directed, for example, if they said, "Okay, I want you to think of something really, really sad," you know,
Yes.
is there a particular electrical pattern of that could be identified as this patient is thinking of something sad, you know,
Hmm.
or I don't know if emotions can be identified in that way. Uh, uh,
Mm. So it's an interesting question, Guy.
yeah, it's it's one possibly for further investigation, but yeah, if a musician comes to you, if a practicing musician comes to you and is diagnosed with epilepsy, is there any particular advice that you would give them, such as possibly set list or trying not to overexert themselves or anything specific to musicians that you wouldn't necessarily say to the general population who aren't musicians?
I think in terms of sort of lifestyle advice, probably very much the same, to be fair. We counsel about the main triggers to seizures, as you say, being tired.
Hmm.
Sleep, we've not mentioned that, but sleep is critical. To Good sleep is critical to support seizure control.
Hmm.
Um, you know, does music have an impact on sleep, which by extension impacts on the seizures? And these are questions, obviously, these are sort of sub questions that need to be answered as
Hmm.
part of any trial. Sorry, going back to the question, yeah. So sleep, avoidance of stress. Stress is certainly a big trigger to seizures.
Certainly is, yeah.
Um, you
Mm.
know, uh, and then all the usual things, making sure that they take the medicine as prescribed, etc. I
Mhm.
think probably one of the things that I would maybe think about, certainly some anti-seizure medicines, they can alter your pitch perception. So, if this is a professional, if this is a professional music, well, no, actually, any musician
Mhm.
might want to avoid sodium channel blockers. It's
Mm.
rare. It's rare, but it is something to think about. But it isn't something that I necessarily count.
Does that include sodium valproate? Uh,
No, it's mainly with things like carbamazepine,
right,
and there's been some cases with lamotrigine as well. So
right.
yeah, it's something
That's
to be aware of.
interesting. Because carbamazepine was for a while one of my medications.
Right.
Uh, so
Yeah.
I didn't
Yeah.
realize that
No,
ultimately I could
it's
be
it, it's
doing
rare. It's not.
myself some musical harm. You know?
It is rare.
Uh-huh.
It wouldn't necessarily be. I think there are other things to consider.
Mhm. Yeah.
But it is a, if you have got a professional musician who is on, say, carbamazepine, you probably
Mhm.
do need to counsel them about that as being a very, very rare risk, but a potential risk.
Mhm. Yeah, I mean that's something that has been discussed before with regards to risks.
Mm,
Is at what point do you consider uh, as as a clinical professional? At what point do you draw the threshold as to whether something is a risk worth mentioning or a risk not
mm.
worth mentioning? You know, I
Yeah,
suppose that comes down to individual
yeah,
decision.
yeah. So we would always mention common risks.
Mm.
You're going to be mentioning the typical things like allergic rash,
Hmm.
sedation, dizziness, double
Yeah.
vision.
Hmm.
You might want to mention something more rare like that,
Hmm.
if you've got, as I say, if you've got a professional musician in front of you.
Hmm.
Um, but generally speaking, if that isn't the case, it may not be something that you routinely counsel about.
Hmm. It's interesting because obviously you mentioned musicogenic seizures.
Mm,
One other case that I read about quite a long time ago now was a professional flautist whose seizures were actually triggered by repetitive finger movement.
right.
So
Yes.
she was rehearsing for a new piece, and each time she got to a particular point in the piece, she would have a seizure.
Right. Yes.
Can't remember the name of that type of seizure. What is it when it's triggered by repetitive movement? Um, uh,
I think with musicogenic seizures, I think the general consensus is that it's an emotional
Emotional
an
reaction.
emotional
Yeah,
reaction.
yeah, yeah.
So maybe this individual's had a seizure
Uh-huh.
when she's been playing
Uh-huh.
repetitive, when she's been playing a fast element of music, and it's almost there's almost an expectation that it
Yeah.
might happen, and by
Mhm.
expecting it to happen,
Mhm.
you're almost like willing it on. You're
Yeah.
creating a stress response around anticipation, shall we say,
Yeah.
anticipation
Yeah.
seizure.
That's an interesting
Um,
concept. Yeah.
yeah. So rather than it being anything else,
Uh-huh. Yeah.
I think that's the general thought with this.
Uh-huh.
Albeit, some people do seem to have more spontaneous seizures as well. So yeah, I
Mhm.
mean, hence why you have got to treat patients with anti-seizure medication, irrespective of whether it's musically triggered or not.
Mhm. Yeah.
Um, so
Um, and I mean, as if somebody was to say to you, okay, I want to try music therapy. Will that
yeah,
work?
yeah.
What would what would be your honest answer to them?
Um, I don't. I mean, obviously, at this moment in time, the date we need more randomised controlled trial data.
Mhm.
I mean,
Mhm.
there's a handful of RCTs, but they use different parameters, and the heterogeneity is quite large.
Mhm.
So you could say, there is there's indicators in the data that this Mozart sonata may potentially have a positive impact on your seizure counts, but it comes with, it's not robust, shall we
No.
say.
Yeah.
I think that's what you have to say.
Mhm.
Um, because musicogenic epilepsy seems extremely rare, the risks of
Mhm.
them trying this are probably actually not going to be that high. So
Mhm.
if they wanted to try it, I would say fine, go ahead.
Mhm.
It may
Mhm.
work, it may not.
Mhm.
Um, so I wouldn't stop them from going ahead and trying whatever it is they wanted to do. It's just that being able to robustly counsel them on the risks and benefits
Mhm.
is quite difficult,
Yeah.
as with many areas of epilepsy and medicine in general.
Yeah.
Yeah,
Yeah. I think as much as we do know, I think we're
yeah,
still in a position where there's even more that we don't.
hmm
Uh, and obviously, what we do know is advancing all the time, but then that in turn creates more questions. Uh,
yeah,
but what if? Well, if it's this, but what about that,
hmm
etc. Um,
yes,
but certainly, I think we are a lot further down the line than we were, say, even 10 years ago. You know.
yeah.
Uh,
I think it's not what I have noticed. It's nice to now be seeing presentations of music and epilepsy at
mhm.
conferences because in the past, I mean, I think it's been a few times I think when I've been asked to contribute towards a session at a
Mhm.
conference, only to find that actually it's been shelved. The actual parallel
Yeah.
session itself has not been approved,
Yeah.
and therefore, you don't present at it. Whereas
Mhm.
I think what I am seeing is that actually it is sort of gaining some recognition,
Mhm.
and it stands to reason. Music, it's sound, it's a waveform. We are electrical beings, and
Mhm.
there is an interaction between
Yeah.
us and music.
Mhm.
Music can give you goosebumps.
Yeah.
It can make you feel very sad. It can make you feel very stressed.
Yeah.
So it must therefore have an impact on brain waves, and by extension, it must have
Mhm.
some sort of neuromodulatory effect on epilepsy. It's
Uh-huh.
just how you go about proving that,
Yeah.
given, as you say, the very the fact that we're all very individual and we
Yeah.
react differently to music, and how you
Mhm.
control for
Mhm.
that's the key thing.
Mhm.
So I'm not sure whether playing different pieces, depending on whether it's Mozart, Haydn, or Beethoven. I don't think that's really going to necessarily progress us
No,
further.
it,
I think we need to be a bit more, a bit, a bit more personalized, a bit more kind of. We need to be looking at it in a different way. So,
mhm, mhm.
um, but yeah,
But yeah, I think we are heading in the general right direction.
mm,
Um, I mean, certainly when I first started flying the flag back in 2010,
hmm,
in Prague,
yeah,
that session was on the use of the arts plural as a means of
yeah,
non-verbal expression of experience of living with epilepsy.
yeah,
And what I highlighted to Stephen Schachter was that apart from Michael Trimble's presentation on epilepsy and opera, there was there was
nothing.
no
No,
trace of it, you
no,
know.
no. It's true.
So like that there was for me the question I'm still asking to this day is there was more than 65 million people out there who live with epilepsy.
Hmm.
Surely I can't be the only individual who's thought it was a good plan to actually explore using something as useful and dynamic as music
Totally agree. Yeah,
to express and to a large extent educate about epilepsy. So I mean, for the way I always put it to people is that music and epilepsy are both singular words for enormously complex and diverse things
yeah,
and
yeah.
very individualistic as well. You might have 10 people who have exactly the same seizure description, say tonic clonic or focal seizure or whatever, but those individuals' experience of them will be as unique as they are,
Hmm.
you know?
Yes,
Yes, there could be some crossovers, but there will equally be places where that person's interpretation of their experience is as unique as they are.
yes,
And that's where I think music definitely comes into its own because music can convey that experience where often words can't.
yes,
So I've said before to people that essentially asking somebody what does an epileptic seizure feel like is is a bit of a redundant question in a way, because it quite often doesn't feel like anything else. It's in many cases it's non-comparable. It's
yeah,
not like anything at
no,
all. So
no,
that's where something non-verbal can take up the reins.
hmm,
And I also use the example of John Williams, phenomenal composer, obviously one of many, but he can elicit a musical, emotional response without saying anything at all.
no, yeah,
Uh,
yeah,
and I
absolutely.
mean, take Jaws as the ultimate. Another theme from Jaws. You've got
Hmm.
two notes, a
Yeah,
semitone apart.
hmm,
Nobody said a word, but people will have the desired emotional response to hearing those two notes.
yes,
You know, and every
yeah,
time they hear those two notes played down at the bottom of the register, it will elicit, in many cases, that same emotional response as it did the first time they saw the film.
absolutely. Yeah. No,
Um,
it's incredible.
and just as there are so many types of seizure, I know there's at least 40, but when you go into subgroups, there's probably even more than that. Um, Equally, there are a huge amount of genres and subgenres of music,
Yes,
you know.
absolutely.
Uh,
Yeah.
and in order to convey the experience by using music, you don't even need to speak the same language as the other person. Because I have heard it said that when it comes to communication about the experience of epilepsy, linguistic barriers are very much a real thing.
Yes.
Because not all languages uh, have a word for epilepsy.
No.
You know?
No.
uh, so that's my little uh, kind of soapbox moment. Um, but yeah, I mean, as I say, I can't be the only person out there with epilepsy and musician. Um, but there are very few labeled musical representations of epilepsy. Um,
Yes.
do you have any ideas personally as to why you think that is? Uh,
Um, as in, as in epilepsy being represented in music. Is that what you mean?
yeah, music that represents.
Music that
Uh,
represents epilepsy.
yeah.
I don't know the answer to that, Guy, I'm afraid.
Mm,
I mean, I think I know why. I think certainly research, if you're thinking about research now and funding, because obviously
mm,
everything needs to be funded.
mhm,
Um, I think music is probably in competition with a lot of other areas of interest. Obviously, pharma has always been very much at
mhm.
the forefront of treatment and will get a lion's share of funding.
Yeah.
However, I do think that tide is changing because
Mhm.
we are, you know, God knows how many drugs we've got 30, 40, whatever it is now. Um, and we've still got this one third of people who are drug resistant. So,
Yeah.
despite this vast explosion of drugs,
Hmm.
we're not seeing the improvements that we were expecting. So I think we will be seeing, fingers crossed, hopefully there seems to be a lot more sort of grant calls for innovation,
Hmm.
and obviously this is innovative. Um, so hopefully that will improve, um, not just understanding, but I suppose awareness of music. Um, not as a therapy, I guess, but
Hmm.
also how it might represent somebody's EEG. So I suppose, particularly
Hmm.
going back to the X system, you're
Hmm.
seeing that that being translated in, from a sort of modeling perspective,
Hmm.
which is quite fascinating. But I
Yeah.
think, all these things do require funding.
Hmm.
Unless like yourself, Guy, you are a composer anyway, and you've got personal lived experience.
Hmm.
You're doing it more, from a sort of art
Hmm.
performance
Hmm.
um, perspective.
Hmm.
I'm sure you can't be the only one out there, but it's. I think epilepsy, just in general, has not had the airwaves. Sorry, pardon the pun. That was not meant to be, but anyway, has not had the airwaves.
Hmm.
Unlike maybe other conditions, and we 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 need to be better at advocating. and
Yeah, definitely.
maybe music and it is another medium by which we can communicate to patients, as you say.
Yeah. And also communicate to the outside world as well.
Exactly. Absolutely.
Um,
Yes.
because one of the things when I was in Lisbon, I went to a presentation on stigma,
Mm,
and I spoke to the girl afterwards, and I said that was a very good talk. I said if I'm going to play devil's advocate for a moment, I said I attended a congress in Prague round about 15 years ago and heard somebody else say exactly the same thing as you've just said today, you know. Um, and I said, what one of the problems is that events such as congresses and conferences are speaking to the converted.
yes.
You know, they're addressing things to the people who already know. So the people outside of that Congress should effectively be the target audience uh, for the people in the Congress, you know. Um, but there seems to be that once somebody walks out of that door, that message stays inside, you know. And yes, there are 65 million people at least with epilepsy, but there's an even greater number than that who don't.
Yeah. Yeah.
So I think there has to be some heads being put together to find ways to actually, um, how do we help people understand what epilepsy is and what epilepsy isn't, uh, who don't yet have it, or who haven't yet been affected by it.
Hmm.
Um, because that is the big issue. It's not that they might never be affected by it, but because of the very issue that it can happen to anybody at any time
Hmm.
in their lives, that's why it's such a thunderbolt diagnosis.
Absolutely. Yeah. No.
Because
No.
nobody's ever mentioned it to them before.
No. No.
You know?
Yeah. And there's so many different levels at which that could be improved. I mean, going all the way up to sort of top level government and governing bodies,
Mm.
um, all the way down to the sort of charitable organisations and things like that.
Mm.
Um, we lack. I'm just thinking at it from a sort of neurologist perspective. We are still one of the subspecialties that lack an awful lot of consultants.
Yes, definitely.
In comparison to other areas like MS, for example.
Mhm. Yeah.
It is not, for whatever reason, despite being probably the most treatable out of all neurological conditions, it is not the one that is as attractive to go into as other areas.
Hmm.
Um, and it doesn't seem to, unfortunately, to sort of raise awareness, you kind of almost need to have a celebrity or somebody high profile, that has it,
Hmm.
who has a following,
Yeah.
and is able to kind of raise awareness in that respect. I mean, we've just opened up the Rob Burrows Centre for Motor Neurone Disease in Leeds.
Mm.
He was a rugby player and
Yeah.
sadly, died of motor neurone disease.
Mm.
Um, but he had a very big rugby following, big public following, which enabled funds to be raised to actually support, and raise awareness,
Mhm.
importantly, of MND. It's we kind of need that sort of level of um, profile to tell people, to tell the public, not just people, as you say, that have it, but people who are
Mhm.
yet to have it, what it is. Yeah,
Yeah.
completely agree. Totally
Yeah.
agree. And then and subsequently, we need to improve, the number of specialists who manage patients with epilepsy, because that's a big issue. There's not enough of us.
No.
Yet it's one of the most commonest conditions that we see in our clinics.
Hmm.
So it's kind of, there are many stakeholders that would need to be involved to improve that, Guy.
Yeah,
But
absolutely.
small steps. Even you doing this podcast will
Hmm.
hopefully, um, raise awareness of epilepsy and what we're currently doing in the music field.
Yeah, absolutely. And I've waved the flag for the last 15 years and will definitely continue to wave it all the time. Um, but it's interesting when I was writing that the Purple Universe album. Um, I was having a conversation with somebody at work because I'd seen somebody have tonic-clonic seizures in the Paris transport network, and a lot of people were either just walking straight past or just standing around looking as if to say, what do I do now? Kind of thing,
Right. Yeah.
rather
Yeah.
than making any actual move to try and help. And I was talking to somebody at work about that later on, and they still were of the opinion or the misguidance that you should put something in the patient's mouth, you know,
Right. Yeah.
uh,
Yeah.
which of course is the last thing you would do
Yeah.
because in seizure state the person doesn't know what's in the mouth,
No.
you know.
No. So I think it's capturing. I mean, that's first aid. I mean, that really should be taught in schools.
Mm-hmm.
So
Yeah.
it's kind of almost. I mean, obviously I'm not involved in school curriculums or any of that nature, but um, maybe more could be done in educating people right from young school age about epilepsy.
Yeah.
Could that be be an initiative that at least people have got some basic level of understanding of what it is and how to manage somebody in that situation. I
Yeah.
think everybody's got a role to play
Yeah.
actually in educating and raising awareness. To be fair, Guy, it's not just the medical world.
Well, it
It's
isn't. It definitely isn't. I mean, there was one gentleman in Lisbon who's actually written a children's story
mhm.
uh,
Yeah,
about a young girl
yes,
with epilepsy, and I
yeah,
think I think things like that are vitally important
yeah,
and ideal, really, so that when people are hearing stories at school, then they hear this word
yes,
epilepsy.
yeah,
So it doesn't become one of those under the table words that nobody dares to say out loud, you know.
mm. Yeah,
Uh,
yeah. I completely agree. Yes,
and when I was talking to Dr. Ian Bone, um, one of the things that he said was that yes, epilepsy is in, say, soap operas or films or whatever, but the only problem is the only ones you seem to see are tonic-clonic seizures. And
yeah, that's true.
you know,
Yeah,
because they have the most dramatic effect.
yes,
Uh, but then at the same time as raising awareness of epilepsy, you're also kind of narrowing people's perception of it.
yes,
Um, So therefore, people watch the soaps or watch the film and think, "Oh, I know a bit more about epilepsy now." It's when somebody drops down and has a full-blown seizure and froths out the mouth and makes all these horrible sounds. When, of course, there's so much more to it than that. Uh,
Absolutely. Yeah. No, I couldn't agree more. Yeah, more does need to be done to raise awareness about the condition.
mhm. Um, have you ever, are there any particular pieces of music that what helps you relax musically? If you've had a hard day at work and you just need to switch off, um,
So normally Debussy.
right, Debussy, yeah.
So yeah, so or Chopin, but Chopin I need to practice that a bit more. Yeah, I mean,
After,
yeah, I mean, I do play Mozart actually,
right,
but my fingers are not as agile as they were, and there's a lot, there's a lot of fast,
yeah.
a lot of fast melodies in Mozart.
Mm.
Chopin is just delightful to play. It just feels great to me playing Chopin actually.
Well, I've
Um,
never actually heard you play, and I'll use
right.
the word yet. Maybe one day I will actually get to be in the same room when you actually sit at the
Yeah.
piano and play.
Yeah.
That would be quite something.
Yeah.
Uh, so I mean, personally, I'm not classically trained, um,
Okay.
but uh, yeah, I think there's still um, an awful lot of questions out there, and I think if you were to write a page in 2032, uh,
Right. Will
then
do.
yeah, well, I look forward to it. Obviously, I'll be
Yeah.
a little bit older than I am now, but a few more greys coming in there. You know? They might have all filled the space by then. But no,
But we haven't touched on this, and we probably this might be something to discuss another time. But
Mhm.
we've also got to remember that sound is not always audible. So
That's
there's
true.
inaudible sound. So you've got infrasound, which is obviously less than 20 hertz. So it's outside of our range.
Mhm.
But we don't know the impact of that on epilepsy either. So we've got a sound spectrum here, Guy, that we
Mhm.
need to, obviously infrasound. We're not thinking about therapies here, but
Mhm.
also but thinking about the environmental impact, particularly with renewable energies and things, because a lot of turbines would generate infrasound.
Mhm.
So there's a few other questions, not just about music per
Mhm.
se, but sound and how it
Sound as a
interacts with
whole.
the brain. We've
Mhm.
obviously also got ultrasound being, sort of as a guided therapy
Mhm.
that's currently being explored. So there's a lot to do with sound, but
Yeah.
obviously as a therapy, music is the most intuitive option here,
Mhm.
probably the most palatable option, I would imagine.
Yeah.
But yeah, it's a very interesting field, and hopefully we'll get more developments coming through.
I do hope so. I mean, when my own epilepsy wasn't doing very well, one of the things I kind of had a go at, more or less out of curiosity, really, was a sound bath. Uh,
Right.
and I have to say, the overall experience was very pleasant. Um, it was very nice. And that was actually one of the first times that I was, let's say, more aware that sound is something that you can physically feel.
Yeah.
You know?
Yeah.
I hadn't been as aware of that fact up until that point. Uh, But at the point that she stopped, the practitioner stopped, I could actually feel a physical change
Wow.
in the
Amazing.
environment. Yeah, it was really interesting.
That is
I was
interesting.
lying back indulging in this experience, these different vibrations and rhythm patterns and pitches and such like, and closer to the head and further away and over different parts of the body and such like. And then at the point at which she stopped, I physically felt the stop, you know.
Right. Yeah, yeah,
Thought, wow, that's interesting.
yeah.
Uh, so obviously that in itself would be interesting to look at on a like from a vibrational sense, you know. Are
Mhm.
there particular vibrations that will level out EEG activity
Mhm.
and such like? But as you say, it all comes down to funding as much as anything else. Uh,
True.
and if you say, I'm going to give 10 people a sound bath, those with the money might say, well, all the best, but not with my money, you know.
Mm.
Uh, so, yeah, I think there are still avenues to explore there, definitely. Uh, thank you very much for your time. It's been great to finally speak to you after
Pleasure.
about 6 months of trying or something like that. But with somebody as busy a timetable as yourself, that's obviously perfectly normal and expected. But yes, I hope we do get the chance to talk again. So for today, thank you very much, Dr. Melissa Maguire.
Thank you, Guy.